Arthroscopy, or arthroscopic surgery, is the use of a small fiber optic camera to look inside a joint without having to make a big incision and to provide visualization. So we can typically take a fiber optic camera the size of a pen and insert it into a joint such as the knee, shoulder, and hip through a little tiny stab incision, and we can visualize more inside that joint with that fiber optic camera than we could with making a foot-long incision. The advantage of doing that is obviously it's a far less invasive procedure, and patients oftentimes have far less pain without having to make such large incisions to be able to fix the damage inside the joint. So through one of the little poke hole or stab incisions, we insert the camera, and depending on the area that we are treating, we use other small accessories, small stab incisions, to be able to insert small instruments that allow us to be able to address the damage that we identify with the fiber optic camera. Patients tend to have far less postoperative pain with that minimally invasive approach. They can usually make quicker progress through their rehabilitation due to less pain, less swelling, less bruising, etc. And so it is really the preferred method to address many of the problems of the knee, shoulder, and hip, and even other smaller joints as well. For the most part, I would say arthroscopic surgery is done as an outpatient. There are rare exceptions to that, but due to the minimally invasive nature of arthroscopic surgery, most patients are quite capable and comfortable with going home from surgery the same day. Much of the recovery from arthroscopic surgery entails physical therapy afterwards. The exact nature of the physical therapy that we prescribe and the limitations that we place on patients' mobility or weight bearing, and that will be dependent on the type of arthroscopic surgery that was performed.